All right. Hi, everyone. Welcome.
Hi, everyone.
All right. I'm here with Dr. Shino Bay Aguilera. I came from DC. Had a wonderful day with this amazing gentleman. So excited to be here. How was your day, Dr. Shino Bay?
It was a good day. Actually, it wasn't bad.
It wasn't so bad,
Yeah,
right?
right. Did you learn anything?
Of course, always. I love Dr. Shino Bay.
That's what I like to hear.
Oh, he gave me $100 to say that, obviously. We brought you some rain. I hope you have some umbrella with you.
Well, I live in Florida. It rains
all the time.
All the time, around this time especially.
So yeah, the weather it's a little bit funny these days. But welcome everyone. So I came all the way from DC, and the reason for that is I believe all of us should have role model. Some may not. Some may have two role models. Some may use their parents as their role model. But when it comes in this industry, I even shared this with you earlier, that you're absolutely one of my role models. You've been an amazing role model in this industry for me. I really appreciate you for that. It comes from my heart.
Thank you. I can feel it.
Would you like to tell some of my actually patients who already joined our live, they want to get to know you more. They're already asking some questions. What is your specialty? And they want to know how long you've been practicing.
So my name is Shino Bay Aguilera, and I'm a dermatologist in Fort Lauderdale, Florida. I've been practicing for about 20 years now, and started with general derm. That lasted for about 2 years. And I went all in aesthetics. You know, that's my passion, that's my calling, that's what I love to do, and I think everything happened organically for me.
That's for a reason, right? Mm-hmm. So what is the most favorite thing you love to do about this job?
Any job that I do, because not only I do what I do in my practice every day with patients, but I like to inspire people. You know, I think it's very important to inspire people to be the best version of themselves, inspire people to take care of themselves the same way they take care of their cars or their house. A lot of people neglect themselves, and sometimes it's either because they feel guilty, because they think that if you care too much about your looks or things like that, you're vain, which a little bit of vanity is important.
Right.
Because if it wasn't for vanity, you won't brush your teeth or comb your hair or take a shower, and all these things can lead to diseases and infections. So vanity, a little bit of vanity is healthy. When you go overboard is when we feel like there is a problem.
That's correct. So with the new generation, I know it's becoming a little bit more like an obsession. Sometimes when it comes to filters, sometimes it comes to Instagram. What is your message for a younger generation out there? Because especially especially my area, I get a lot of young girls that they come to my office, they show me a picture, and they're like, this is what I want to look like. I want to have a jawline that is sharp. And I think myself, I share this with you, that Dr. Shino Bay, when I look down, I don't want to see that little saggy skin. So I think our younger generation, we're becoming a little bit obsessed with look. And I think it goes back to filter, and it goes back to perhaps Kardashian and etc.
Yeah, I mean, when you're young, that's when you're the most impressionable. Also, when you are constantly fed these images by hours. I mean, it takes like 2 minutes. Like my friend Sabrina Fabi talks about this, and she wrote a paper about this. Like, if you see an image of big lips, right? And you necessarily don't like big lips. You like to look natural. But if you see big lips for 2 minutes, the brain will rewire, and then you will think that having big lips is going to make you more attractive. So most of these young children, they spend hours and hours and hours in social media. So of course they are the ones who buy into trends without knowing that everything is being manipulated for them to feel that way. So what I tell any of the young people that come across my practice or parties anywhere is that you first need to have self-love and self-acceptance, and you need to celebrate your uniqueness. No one had to look like somebody else, like having a yearning desire to look like Kim Kardashian and Jennifer Lopez and things like that, or people like that. I mean, it's okay to admire beauty, but you're never going to be them.
Right.
And you need to work with what God gave you. And I have no problem if you have an oversized nose, or you have no chin, or you have no lips, and you want to enhance your beauty. As long as you do it to enhance your own beauty, not wanting to look like somebody else. And trying to look like your filters and trying to do everything to achieve this is setting you up for disappointment, because neither you or your provider, even the best provider out there, will be able to match exactly the way you look on those filters. So it has created big problems. Now we have in psychology books people writing about Snapchat dysmorphia and all kind of dysmorphia, which are real. These conditions are real. So a lot of these youngsters, they spend a lot of time manipulating these pictures, to taking tons of pictures. They can take 60 pictures just to get that one good picture. And then on top of that, they filter and they manipulate it. What does that say about themselves when they're alone? Because they know you have to be authentic. You cannot fool anybody, and you cannot fool yourself. You may feel later all this sense of being an imposter out there in the world, because your friends know what you look like without filter. Your parents know, your family know. And it is on the back of your subconscious mind. So trying to, we all filter photos sometimes. Hey, if I look like crap because one eye looks
smaller or
something, filter my eye, but knowing you cannot recognize yourself. I mean, don't filter me. Like I was telling you early, sometimes I take pictures with ladies and they use a filter where they look good and I look like a drag queen. I go, no, don't do that to me.
That would not be fair to you.
So self-love, self-acceptance is important.
What is the relationship between beauty that it comes within or the beauty that is outside? What are your thoughts on that? Because I know you're very connected to a higher power. You're connected to more like, you're not just connected to the physical world. And I know that from who you are. And I know all of us, we know that, okay, there's an inner beauty and there's outer beauty. But then I feel like 80% of the time, a lot of people focus constantly on outer beauty, and no one mentions anything about, outer beauty and or what can we do to also love ourselves or to love the way we are. So what are your thoughts on that?
So, the first thing for your question is to remind everybody that external beauty comes with an expiration date. So you better be so beautiful inside that when that expiration date comes to you, because it will come, we all will grow older. The best version of ourselves with what we can do these days with injectable fillers and lasers, but we're still gonna get older. I'm not gonna look like this forever, although I'm gonna fight it. But you need to be a good person and have a lot of internal beauty, because external beauty comes with an expiration date. But people need to understand where this yearn for youth and beauty comes from, because we cannot escape it. It comes from the primitive mind, from the caveman time. Beauty, it is an asset. But more than beauty is being attractive. You could be the most external, physically beautiful person in the room, but you are not the most attractive. There's a difference between being attractive and being beautiful, because all of us have met people that are physically beautiful, and the minute they open their mouth, you're like, ugh.
I don't want to talk to this person.
Just look pretty. Don't say anything, and that doesn't take anybody. You better be attractive, and to be attractive comes from within. How do you make others people feel? That is the most important thing, because if you feel like being externally beautiful is going to get you places, it just only can go so far, right?
No, I do agree. I think as, I meet a lot of, younger girl. They, constantly their focus is like, I want to look like this, I want to look like that. But as Dr. Shino Bay mentioned, it's so important to, one, love yourself, but also love other people, give them love. Your personality will always shine. As you mentioned, there's some people, they walk in, they're like, oh my God, they're absolutely beautiful, they're gorgeous. But the second they open their mouth, you're like, oh my God, I don't want to even talk to you. And there are times that we judge someone, and the minute we get to know them, you get automatically attracted to them because of who they are inside. So my piece of advice to younger generation or older generation, doesn't matter, is one, love yourself, love who you are, but also make sure your personality shines through your action. And I honestly, with all means, that's one thing I love about you, that people, like anyone, whether it's in DC area, whether it's in Brazil, whether it's different continent, people love you and they want to get to know you. So I'm very humbled to know you and so lucky to be here with you. And that's why I thought I came all the way here to learn from you. So I have one more day to be next to you. But I thought this would be a really good opportunity to also share with my patient who you are. I always like, your spiritual messages on Instagram. It touches so many people's heart. And you're not aware of that, because you're here, you're doing your own thing. But people in DC, they talk about you and how it lifts their spirit, and it can change someone's day. So we're so thankful to have you.
I'm happy to be here, and I love everybody in DC. One of my favorite cities. Great memories. I have great friends there. So beautiful DC and all the surrounding area.
So a couple questions. So tell me, what do you do for fun? People are asking, what does Dr. Shino Bay beside being a doctor?
I love to dance. I think that's where I'm the happiest. So I always tell people, I set the tone of my day. I live with intention and purpose. A lot of people forget to do that. And they get up and they just eat, they do everything they need to do, they rush to work. But I always set up before I put my foot on the ground. I try to do something that is going to be positive, is going to set the tone on my day. And I bring that with me into the practice, and I set the tone in my practice. If you come here, all you want to hear is laughing and laughing, and that is me. I'm a happy person, and I feel like what I do, I get up in the morning, I meditate, I do yoga, and then I put music, danceable music, and I dance. I go in the shower dancing, I come out of the shower dancing, I get ready dancing, I leave out the door dancing, I'm driving dancing, listening to music. I'm just happy. I feel it in every cell of my body, so I like to dance. That's what I like to do.
Any hope of training in Southern California anytime soon?
Anytime. This COVID has changed a lot of things, but usually if I'm going to do a training in the West Coast, it's going to be sponsored by one of the pharma company. Like Galderma tends to bring me a lot to California. Merck's not so much. Alga. So usually Galderma is the one that brings me to California. So from time to time I do that. My master classes, right now I execute them in my practice because I have a whole routine. It's not only about teaching you about my techniques. My routine is I gotta get the artist out of you, and then I like to have fun. So I have a whole thing to have fun right after the master class. So that's the reason I keep it in the house.
Thank you for sharing. So what is your suggestion when it comes to how early it is to start having like Botox or fillers for a younger generation? Like how early do you think that's acceptable for someone to start using these treatments?
So I think as you an adult, and a young adult, as soon as you see is you getting etching lines like the number 11s or wrinkles, the sooner you start, the better. I started at age 32. With fillers, I started at age 37. So aging is architectural changes. So as soon as you see an architectural change, then you put it back where it used to be. And especially the young generation, especially the millennials, which millennials are not so young, some of them are now 41 years old, but some of them are under 20s. But millennials are very cost effective because they went through the recession of 2008, then they get hit again with COVID.
Yeah.
So they like to be cost effective. And a way to be cost effective when it comes to anti-aging is, when do you start to inject and to prevent? Well, the earlier you do, the better you're going to look. So we all remember, I mean, I'm going to be 53. I remember my grandma, 53. She did not look like this. She looked like an elderly woman.
Mm-hmm.
So the reason I look younger is because I started an early intervention with aesthetic procedure. Without going overboard, little tweaks.
Mm-hmm.
So they call tweakments, not treatments.
Tweakment, I like that.
Tweak. And then you can get to 50 and 60 and look like a younger person.
So what are the laser treatment you recommend for whether it's skin tightening or whether it comes to treatment of fine lines or discoloration?
So there's different lasers for everybody. It depends on your lifestyle and also the degree of some damage or intrinsic aging of the skin. So there's people that look like they walk in the door and you're like, oh my God, they really need Jesus, like a miracle, or Buddha, Krishna, whoever you pray to. There's some people that would look like that. So then you get the big guns, like the CO2 lasers, the erbium lasers, but they take a long time to heal. I mean, these days, for people, these days, a long time is a week.
It's a week, that's a long
Back
time.
in the day, a long time would be a month. But thank God the technology has changed. So a week. And then there's lasers that are very simple, effective, but for people that just want to do some prevention, stimulate some collagen, that we have like the Clear and Brilliant is a good laser for somebody that wants to do it today and tomorrow they need to go back to work, but it's still effective. And in the middle of the road, you have the non-fractional lasers like the Halo, a firm laser, the Fraxel, non-ablative. These lasers, you heal a lot faster. And then you have other energy devices that are like the old therapy technique, ultrasound wave. And then you have radio frequency that you do it today and tomorrow you're just going to be slightly swollen.
One of the folks here is asking, is there anything particular you would recommend for someone's eyelid? Because there's all this treatment, I mean, obviously we know, for under the eye area, you know, whether it's retinal eye cream, whether it's, you know, hydrating serum. But what can be done for correcting around the, you know, eyelid, the upper eyelid? And I know surgery-wise would be blepharoplasty, but non-surgical, if anyone wants to prevent aging around that area, what would you recommend?
So everything has to, depends on the skin tone, Fitzpatrick skin type. So there's 1 through 6. I am a 4, you are a 4. You know, this is like a mocha type of coffee, café con leche type of color. And that's a 4. Then you have the olive color, but it's a light olive. That's 3. Then you get 2, that's white. And then you have very, very, you know, fair type of skin. The further skin, the better you do with laser because you can be very aggressive. The darker the skin, then the least aggressive that you can. So what I do after each birthday, I do a fraction of CO2 on my upper lid. Okay. And that laser you can use safely up to skin type 4, like us. Darker than us is not that safe because you can create discoloration. You can do the erbium as well for lighter skin type. The good news is that the darker skin types, we have already built-in sunblock. So we don't have as much problem with early aging of the area around the eyes. So the people that do, then you can do stronger laser, CO2 and erbium.
I see. And then as far as PDO, do you want to share? I can open that for you.
No, it's okay.
It's okay. Okay. I know you were, I think it's all 8.
Yeah, I didn't follow the instructions well, so I'm just gonna glance at
We're gonna give Dr. Shino Bay F for this. I'm just kidding. No, you get an A+.
Hey, I'm a dinosaur. I just look good.
You're actually, you're a very cute dinosaur. How about that? PDO thread lift. So some of the younger patient here, they're asking about PDO thread, and what are your thoughts on those?
I mean, I love it. I do it in my practice. It all depends. You have some PDO threads that will condition the skin, so like the smooth, and then you have PDO threads that have barb, or they kind of like hook up the skin, or they can hook up the fat, the superficial fat compartments, and reposition it to a higher position. I love them. I don't abuse them, but I think the future of aesthetic medicine is regenerative aesthetic medicine, and which means that everything that you would put in your body will turn into you.
Indeed.
So I love the idea that the skin gets better with the stimulation of the patient's own collagen.
Got it. Now, since we're talking about stimulation of the collagen, would you share a little bit between the difference of hyperdiluted radius and then Sculptra? In our live, we do have our patient, but then also there are some providers that they're interested for you to share your experience, since you're very big when it comes to Sculptra, and of course, again, back to prevention.
So yeah, so it's funny that you say, because I had a meeting last night with Latin America. It was a MERT meeting for Latin America, and it was Sabrina, Fabi, and myself, because we used a lot of all these biocollagen stimulators. So it was a very amazing, insightful conversation about Sculptra and calcium hydroxyapatite, which is radius, and polylactic acid, which is Sculptra. And we both agree that they're wonderful products, and they both condition the skin. I feel like I get a more robust biocollagen stimulation with Sculptra that I get with radius. With Sculptra, you also see a lot more contraction of the tissue, so that's why you see the skin gets tighter. So if I'm going to do just conditioning the skin without tightening of the skin, I will use hyperdiluted radius.
I see.
And if I want a little bit of contraction of the skin area so things get tighter, I would use Sculptra. But on the face, I'd like to use Sculptra supraperiosteal. And Sabrina does the same thing. And even though we inject supraperiosteal, we still get the contraction and the conditioning on the skin, which is something that I don't see with radius. Yet, if I'm going to imitate the superficial fat compartment or condition the skin only, then I like hyperdiluted radius on the face. I do not like to use Sculptra to inject on the dermis for conditioning on the skin. On the face, I only like to use a supraperiosteal.
Thank you for sharing. Someone just typed, like, what do you mean by periosteum? I think that would mean like meaning deep to the bone.
Yeah, so supraperiosteal is that when I inject the Sculptra, I put it right on top of the bone. People say, oh my God, does that hurt a lot?
That's
No. Actually, you feel more with your skin than with your bone, so it's just weird, the sensation that somebody is right on your bone. But what a lot of people don't know, that part of aging is that you lose the bone on your face.
Yep.
So when you enter the 5th decade, when you turn 50, your bones start to disintegrate. And when your bone disintegrate, then you start looking more and more like an elderly person, like the way grandma and grandpa used to look. But if you save the bone, if you preserve the architecture of the bone, which I believe polylactic acid can, and again, I do my living preserving the architecture of the bone, you get to 50s and you still don't look elderly, like, Jennifer Lopez and all these beautiful women, Cher. But if you don't preserve the bone, it doesn't matter how much money you spend with fillers and energy devices like lasers, you're still gonna get old. If you don't preserve the bone, you're gonna be an old lady, an old man with good skin.
But there's no bone structure.
Or
like
an
that's
old lady
the foundation of your house, like a house. One thing I learned from Dr. Shino Bay, and actually this time it kind of kicked in more, is your bone structure. Like, I feel like I remember my father being this, tall man, that now he's, 75. I'm like, my dad has shrunk, he's much smaller and he's not as tall as he used to be. And that crosses my mind that, yes, as we get older, we do lose bone. And that's the foundation of our face. Just like your house, when you built your house 30 years ago, if an earthquake comes, your house can be more in danger versus someone who has built a brand new house and the foundation is stronger. So as Dr. Shino Bay mentioned, all this, toxin, all this, wrinkle prevention treatments are fantastic. But if we don't save this fantastic structure, which is our bone, especially when it comes to our face, everything else become pointless.
Especially that. So one thing about the bone in the body is like you have the opportunity to make your bones and your body stronger by lifting weights and weight exercises. but the face is floating on top of your neck, so that doesn't get that advantage of getting sturdy like the body. So the bone on the face starts to disintegrate. So that is the problem. And now, for women, it's the worst because women is already weak on the lower face.
To begin with, absolutely.
You lose 30% more bone than men because of menopause on the jaw, on the maxilla. And on top of that, now a lot of people, because of stress, they're clenching. And when you clench, you have premature bone loss. So I see on women that are like 35, 38, a jawline and a chin that should be on a 60-plus-year-old woman. So it is very important to preserve the architecture of the bone and go to a provider that knows how to do that.
And I think some of us as a provider, I think it's our responsibility to educate our patient. And I respect you because you're such a huge, I mean, you focus on education. And I have seen you with your patient that you spend the time and you explain to them how things works out. I believe that even me as, a nurse injector, for the longest time, I always thought Sculptra will just give you collagen. Sculptra will give you perhaps, volume. You can use Sculptra for butt enhancement. However, it was never brought to my attention that, hey, there is a solution to perhaps save your bone. And especially women, because of our genetics, we do have smaller bones, but then also premenopause, menopause, osteoporosis, all of this aspect affects, our bone situation. So I appreciate you sharing this, and I hope that I can share this, with my patient and, with our lovely people who's watching this live.
Yeah, polylactic acid is a very special product. I mean, Sculptra had a bad reputation back in the day because nobody knew how to use it. Mm-hmm. Even I was like, stay away from me with that product. But then I found the value of Sculptra. And Sculptra is nothing that is not new. It's been around since 1932.
For HIV patients?
Yeah, well, in 2004 it was brought into United States for lipoatrophy, HIV patients. And that's why we learned the importance of fat in the face. Before that, when people did surgery, they started taking fat. Fat was the enemy. Now fat is the friend.
Fat is the best friend, yeah.
So in 2004 for fat, try to help the patient with HIV, and 2009 for cosmetic. But this product in 1968, which was the year I was born, was a good year.
He's still 21, keep in mind, how...
So in 1968, Sculptra was used as a bone filler. And what they noticed was when they injected into the bone, the osteoblasts, which are the cells that produce bone, lay down new bone. If you inject Sculptra on the dermis, it creates collagen. If you inject Sculptra inside the bone, it creates bone. If you inject Sculptra in the fat, it creates fat because those ladies that are doing Sculptra on the butt for butt enhancement, do you think that butt is full of collagen? No. It's creating
nutritioning the fat, yeah.
Yeah, it allows, so it's a very special product that allows us to imitate tissue.
No, that's great. I have seen that, a lot of patients comes thinking by just adding more and more volume, they're going to prevent their face from getting old. And actually, that's actually you're affecting your anatomy. You making yourself look like I don't know, like someone who's holding an apple in their mouth, or it just looks very unattractive. So therefore, the goal is not just adding volume. The goal is to maintain a healthy tissue, maintain a healthy skin, but also helping your body to preserve the bone, collagen, and fat at the same time.
100%. So one thing to say is that cheekbones are a sign of youth, beauty, and fertility, and women knows this because you do play tricks with blush and contouring to have a stronger looking cheekbone, and it does work, right? It makes you look younger, it makes you look beautiful. You will not dare go out of your house without contouring or putting blush. So, since this is an important structure in the human experience, then you should not alter it to the point that you bury it, or you make yourself look like you have two big tomatoes or oranges. You need to maintain it, you need to enhance it, but you don't want to deform it or you don't want to bury it, because if you do that, you lose all these properties of having a beautiful cheekbone that cause everybody to look at you and say, oh, she's beautiful, she's attractive.
No, that is correct. Well, is there anything else you'd like to share? I think we have a few more minutes left before we end this lovely live at 6:30 Fort Lauderdale Eastern Time.
Definitely. It's a crazy day, but I'm glad to be here. No, it's like, for everybody out there, like what we do is more than what we do with the fillers, the bottles, the lasers, you know. My goal is to make my patients feel good about themselves and give them a spiritual facelift. Because at the end of the day, they come to get our light. You know, there's so many people that do what I do, but they come to me because the way I make them feel. So that comes, that for everyone out there should feel the same way when you come in contact with another person, right? You need to ask yourself, what is your presence in existence? What am I doing all these things
for?
And you're doing these things to validate yourself that you are a miracle, that you are here alive in the middle of a pandemic, trying to fight for your life like everybody else, including you, including me. So don't waste any precious time and moment getting obsessed about the way you look. If you are, it needs to be in a good way. You need to love yourself. You need to appreciate what you got. You need to appreciate where you come from. And you should stop wanting to look like somebody else. And you should not lose sleep because you see a new wrinkle or a little skin saggy. You come and get fixed. You know, go to your provider, fix it. But don't make your day obsessing about beauty and about youth. Because all you want to do with that is age yourself faster. There's nothing worse than stress and obsessing about something to make you get what you don't want in life. So yes, look at the mirror, say to yourself, I love you. You are beautiful, just the way you are. Because at the end of the day, there's only one person that looks like you. Even you, if you have an identical twin sibling, sister or brother, he is completely different than you. He comes or she comes with her own personality. Nobody can replace you in this world, in existence. If you were to perish tomorrow, you're going to have a lot of people missing you that love you. Amen. So if you don't love yourself, you cannot love anybody else. So before you come to anyone to improve your outlook, you need to start working with your soul and how you make people feel when they're in your presence. That's the most important thing. The rest of it is like icing on the cake.
Oh, thank you so much. I really appreciate you for your time. Thank you everyone for joining us. Again, this was such a wonderful opportunity for me to learn from you, and I was able to share some of this information with my friends and family, perhaps in DC or all over the place. Thank you guys for joining us. Thank you, Dr. Shino Bay.
Thank you, everybody. Be safe out there.
We love you guys. Thank you. Oh, thank you so much.